Welcome to The Explainer. Today, we're diving into a really big question in the fight against advanced breast cancer. We're looking at a major clinical study called the PATINA trial, which was published in the New England Journal of Medicine.
I mean, just think about that. Could something as simple as one extra pill give people more than a year of extra time before their disease gets worse? The PATINA trial wanted to find out if this was possible for patients with a particularly aggressive form of breast cancer. And, as you're about to see, the answer they found was, well, it's both really promising and pretty complicated.
All right, so to really get what's going on here, we first have to understand the specific challenge that researchers were up against. Not all breast cancers are the same, and this trial was laser-focused on one very specific, very stubborn subtype.
We're talking about something called HR-positive, HER2-positive advanced breast cancer. Basically, this is a double positive cancer. It has two different engines driving its growth. It's fueled by hormones, and it's fueled by a protein called HER2. This type actually makes up the majority of HER2-positive breast cancers. So because you've got these two different engines, you need to attack it from multiple angles. But even with the best treatments out there, doctors keep running into this one huge hurdle.
And this right here is the heart of the problem: treatment resistance. Cancer cells are just incredibly adaptable. They can learn over time how to survive and even grow, despite the very drugs that are designed to stop them.
It really shows you how ingenious cancer can be. Think of it like a GPS in your car. If the main road is blocked by a standard therapy, the cancer cell doesn't just give up. No, it just finds a detour, another pathway, to keep growing. So the scientists behind the PATINA trial knew they had to find a way to block not just that main road, but all the possible detours too.
So this big challenge led researchers to a whole new idea. They started thinking, what if, instead of just blocking the signals coming from outside the cell telling it to grow, what if we could shut down the engine inside the cell that actually lets it grow in the first place?
And that's where this class of drugs called CDK4/6 inhibitors comes into the picture. The specific one used in this trial is called Palbociclib. It works by going right after the cell's fundamental machinery, its ability to divide and make copies of itself. This is a completely different angle of attack.
So the theory was, if you could hit the cancer from 3 different sides all at once, you block the hormone pathway, you block the HER2 pathway, and you shut down that cell cycle engine, you could just overwhelm its defenses and stop it from ever developing that resistance, a real 1-2-3 punch.
Okay, so how do you go about testing a big idea like that? Well, you run a huge, randomized phase 3 study, which is the absolute gold standard in clinical research, and that's exactly what the PATINA trial was. It was designed to get a definitive answer.
The setup was actually beautifully simple. They took nearly 520 patients and split them into 2 groups. The first group got the absolute best standard of care available. The second group, they got that exact same treatment, plus 1 extra pill, Palbociclib. And because the design was so clean, any difference in the results could be tied directly to that 1 additional drug. Now, the main goal here wasn't necessarily to find a cure, it was to measure time. How much longer could this new combination keep the cancer in check, keep it from getting worse? In the science world, this is called progression-free survival, or PFS, and that was the #1 thing this trial was looking at.
So after following these patients for a median of over 4 years, the data was ready and the results were in. And what they found was a classic medical story, a really big step forward, but one that came with a significant challenge.
The headline number was pretty incredible. For the average patient who got the extra Palbociclib pill, their cancer was kept under control for nearly 4 years, and that includes the initial, more intense part of the treatment too.
Just look at the difference here. That 1 extra pill added over 15 months of progression-free survival compared to the standard therapy. That is more than a year of extra time for these patients. It's no wonder the study's authors called this a meaningful clinical advance.
But, and you knew there was a but coming, in medicine there's almost always a trade-off. While the new drug was fantastic at controlling the cancer, it also had a really big impact on the patient's bodies.
The data on side effects is just as dramatic as the data on how well it worked. The rate of severe adverse events, we're talking grade 3 or 4, jumped from about 1/3 of patients in the standard therapy group to nearly 90% in the group taking Palbociclib. That is a massive difference.
So, what was causing this? Well, the main culprit was a condition called neutropenia. It's a sharp drop in a certain type of white blood cell that helps your body fight infection. As you can see, only 2% of patients on the standard treatment had a severe case of this. But for those on Palbociclib, it was over 60%.
This is something doctors can manage, but it often meant patients had to take a lower dose of the drug.
So after all that, what's the verdict? We've got a drug that clearly works, but it also clearly comes with more side effects. Does this actually change how doctors should treat this cancer?
Well, the authors of the study themselves had to weigh this exact balance, and their final conclusion, published in one of the world's most respected medical journals, was that yes, despite the increased toxicity, this combination is an effective new strategy for these patients.
So here's the bottom line. The PATINA trial has given doctors a powerful new tool, but it's not a simple choice. It means that the conversation between a doctor and their patient is now more important than ever. It's about carefully weighing that amazing benefit of more time against the very real challenge of managing the side effects.
And that leaves us with this question, a question that's really at the heart of so much of modern cancer treatment. How do we value time? There's no single right answer for everyone. It's a deeply personal decision. But what trials like PATINA do is give us more and better options. They give patients and their doctors the power to make the choice that is right for them. And they keep pushing the boundaries of what's possible in the fight against cancer.